not just adding years to your life, but adding life to those years.
We can't deny that we are all getting older. And so as we get older, we can be at risk for colon cancer. Sometimes having no symptoms is also part of the list because early colon cancer has no symptoms.
Prevention is still better than cure. Good day, everyone. I'm Dr. Jing, and it's a pleasure to welcome you back to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts. In honor of Colon Cancer Awareness Month, we have a special episode lined up for you. Today, we are graced by none other than Dr. Alexandra Laya, a St. Luke's gastroenterology specialist who will delve into crucial aspects and information about colon cancer. Good evening, Dr. Laya. Thank you for joining us today.
Thank you for having me here, Dr. Jing.
So, Dr. Laya, can you share with us some common risk factors for colon cancer?
So colon cancer is a big thing right now. We are hearing about a lot of our friends and colleagues developing colon cancer. Colon cancer is a malignancy that develops in the large intestine. The large intestine is the last 5 feet of our digestive tract. Anyway, in the colon, we can develop polyps, and we know polyps can turn into cancer. And so this is why colon cancer appears to be a very preventable type of cancer because it's very predictable. Polyp turns to cancer. And so when patients ask me what are the risk factors for developing colon cancer, in my mind, I always think anybody who has a colon can develop colon cancer.
You're right.
Because growths can develop in the colon. But there are some things that we know that can increase an individual's risk. Probably on the top of my list is the genetics. If your family member has colon cancer, your sibling, your parents, a child, immediate relations, which means that you share the same genetics.
Yes, and it's not something we can change.
We were made that way.
Yes.
And so that one definitely is a big risk factor. Age is also a risk factor. We can't deny that we are all getting older. And so as we get older, we can be at risk for colon cancer. It used to be 50, kind of like the marker for where we start screening for colon cancer. But 45 is the new 50, and so we start screening younger individuals because we noticed that colon cancer appears to be affecting even the younger population.
So that would be genes, age, and
Correct.
45 is the golden number for
Yes.
colon cancer awareness or colon cancer screening.
Yes.
Any other risk factors, Dr. Laya?
We now go into kind of the things that our lifestyle. okay?
Lifestyle.
So the things that we ingest, like alcohol. So those who are heavy drinkers, would be at risk for.
What about just light drinking, Doc? Some patients would ask, what about if I'm just a social drinker, Doc? What would
That
would
does
the
not
answer?
increase the risk
It doesn't.
significantly.
Not significantly, but it still does? Or not significantly?
Not significantly.
But they can think about their liver as well. Yeah.
Yes, that would be another thing to think
Okay.
about. Tobacco or using even the reduced risk products like vaping.
I see.
That can also increase an individual's risk for colon cancer.
Oh, vape and colon cancer can be associated.
Any kind of exposure of tobacco, which are carcinogens, can put you at risk for colon cancer.
Okay, so
If you have a sedentary lifestyle, so we need to move, we need to exercise because those who are sedentary, same thing, another risk factor. Our diet also plays a role here. So if our diet is low in fiber, so vegetables are important. So if we
Yes.
have a low fiber diet, if we consume a lot of red meats or processed foods, definitely another one that goes against you. In line with having a poor diet, a sedentary lifestyle, being overweight and obese also puts an individual at higher risk for developing colon cancer. So talagang we need to be healthier, we need to move more, eat better so that we can decrease our risk for developing colon cancer.
So, Dr. Laya, thank you for providing your insights, as it is essential for our audience to be aware of these factors. Moving on to symptoms, Dr. Laya, what are the common symptoms that a patient might feel if he or she has colon cancer?
This one, we need to be very observant of our bodies because the symptoms are subtle, and sometimes we mistake these symptoms to be something inconsequential. Gassiness, bloating, abdominal discomfort. These are very common symptoms that we
Yes.
have. But the thing is, if it does not go away or if it progresses, it can already be a clue that you have something going on in your intestines. Changes in your bowel habits. All of us have a regular pattern. We have our own normal pattern. And so if there's any deviation from that, whether it is developing diarrhea or constipation, or the poop suddenly starts looking funny, it looks stringy or very thin, definitely another red flag for us. When you have that feeling that you don't empty everything out, again, something to think about as a possible clue. Bleeding is also a big red flag. Anytime we see blood in the poop, on the toilet tissue, in the toilet water, it should raise the question, could there be something going on in my intestinal tract?
So it's actually good practice to check our stool, no, in the toilet bowl, because it might just be, you go and then you wash up and then you flush and not even check your stool. I think it's important for us to develop that habit as well.
Definitely. If you have changes in your appetite, changes in your weight, losing weight when you're not trying to lose weight. Losing weight is hard. And so if you're losing weight without much effort, you have to think,
Why?
baka hindi ito ganun ka ganda. And so something to talk to your doctor about. Any of the things that I mentioned, sometimes we can explain it because you ate pasta that was not too cooked or chicken that was raw. When we have digestive infections, sometimes we can already have the symptoms that I mentioned. And so again, the importance of having to talk to a doctor about symptoms that are inconsequential or just can be monitored, as opposed to symptoms that warrant immediate investigation. The most important thing to me when patients ask me about what the common symptoms of colon cancer are, sometimes having no symptoms is also part of the list because early colon cancer has no symptoms.
Oo nga. Actually, if you feel symptoms, then it's already like bigger,
Maybe a
or
little bit more advanced, a little bit more complicated. And so not having symptoms can still be part of the things that you have to watch out for. So a lot of patients ask, Doc, paano yun? Wala naman akong symptoms. This is why
we have an
go to
age.
Yes, we
That's
go
why
by virtue of age.
We have that magic number,
Yes.
45, no?
45.
So before it was 50, right?
So many medical societies are now advocating earlier screening. Why did this happen? It's because we saw that younger individuals are developing colon cancer.
More and more of these younger
the
people.
numbers are climbing.
And sometimes, we'd know that they're in their stage 3 cancer already without initial symptoms. Bigla na lang.
Exactly. And so because, diba, I mentioned earlier that we know that the progression of colon cancer starts from a polyp to a cancer, and you can catch it before it turns cancerous. And so when we are picking up patients who are young, developing colon cancer, had we done something
Earlier,
5 years earlier, 10 years earlier, we could have probably changed the course of their life. So,
course of their life, not just the disease. It's really important to screen early.
Definitely. It makes a difference. It changes your life. It is a possible cure, not just a treatment.
Just screening, it's not just prevention, but it's also curative. Dr. Laya, if you have a relative with, for example, colon cancer, for example, your parent, a parent has it, do you follow the 45 number, or is there a certain number of years? For example, your mom had colon cancer at 50. do you have to screen the children earlier than 45? Or
Yes, so those special groups, special patients who have very high risk, we push it up even earlier than 45, 5, 10 years earlier than that.
So not just the number, but also the family history is very important.
That's correct.
So you better start asking around your relatives what conditions they had in the past, because usually genes really dictate a person's future diseases, even lifespan, no?
Definitely.
And we can do something about it if we screen early and catch something earlier, and you can actually halt a condition from progressing.
For sure, and it is something that we can do by, very simple interventions, very simple tests, very simple procedures.
So Dr. Laya, what are these screening procedures for colon cancer?
So I often talk about three things. Colonoscopy, which is the best that we have. I often say it's the Jaguar, Maserati,
Of screening procedures.
of screening procedures. It's the best that we have for
Colonoscopy.
prevention.
It's
That's a
really how you
colonoscopy.
are able to see the insides of the intestines.
And
the
more
large
than that,
intestines.
not only can you see what's going on inside, you can already intervene. So if you see a polyp, which is the precursor to cancer, and remove it, cure. I mean, it prevents cancer.
Goodbye,
It's never
polyp.
going to be
Big
a cancer because you took it out during that procedure.
So Dr. Laya, can you tell us more about how a colonoscopy is done? Because it
Okay.
may be intimidating for patients. They might get scared.
Yeah, it was funny when I had my first colonoscopy, and I was already a gastroenterologist.
Okay.
I was also kind of scared. I felt my heart racing and I
Okay.
was a little anxious about it. But after your procedure, the first thing that you'll say is, yun? It's so anticlimactic because it really is a very straightforward procedure.
It usually lasts about...
It is around 30 to 45 minutes. It is an outpatient test, so you don't have to be admitted in the hospital. It is a painless procedure.
Painless,
Correct.
yes.
It is under mild anesthetic. So what happens is patients come to the hospital, they change into hospital clothes, they get an IV, yung catheter into one of the veins, and through the IV, you give medicines. It's going to be the best siesta ever. Okay?
I know, right?
Yeah.
It's like you slept for 8 hours.
In Boracay or
I know,
El
right?
Nido.
Oo.
Yeah.
Yun pala, 30 minutes
it's
lang,
a
no?
really nice siesta. Now, while a patient is sleeping, a camera that is on a long and a flexible tube,
Very thin.
very thin
Just
camera,
like a little finger.
like a
side-
finger. Now, at the tip of that finger, there is a light source and a camera, so I know exactly where I'm going. Now, as I go around the colon, I can take pictures, I can look for polyps, and if I see any polyps, I will take it out right there and then. And then when we are finished, we remove the air that was pumped in and we bring patients to the recovery room and then they wake up. And then once they wake up from the procedure, we can already talk about the results and discuss all the findings. And depending on the findings on that colonoscopy, it dictates how often you need your surveillance screening checks. Another one is a virtual colonoscopy. A virtual colonoscopy does not involve a camera going through your bum. It takes pictures of your belly. When we're talking
Almost the same.
about nitty-gritty of things, the virtual colonoscopy probably would be close to a regular conventional colonoscopy when we are talking about polyps that are big.
I see.
Okay, so the smaller polyps, the flat polyps,
Might not be
definitely
seen.
superior ang colonoscopy. Okay. Now, also, a virtual colonoscopy would involve a little bit of radiation exposure. Not much, but there is some exposure.
Compared to just plain colonoscopy.
Which you won't get. It's just the ambient or the regular type of exposures that we have in life.
Okay.
And then poop tests.
Okay.
Stool-based exams. You poop in a tiny little bottle and then you send it to the laboratory for analysis. It tries to detect the presence of blood.
Blood.
With the thought that a colon polyp might drip a little blood in the poop. Microscopic. It's not something that you see with your eyes. But that poop test can identify this. And when that poop test rings positive, it buys you that colonoscopy that you need to retrieve any polyps that may be present in the colon. So
the
those are the three: colonoscopy,
virtual colonoscopy,
and the poop
and
test.
the poop test.
So for preventive services, any of the three would be a choice for patients. But generally, your doctors will always try to navigate you towards a colonoscopy because all your doctors acknowledge that it is the best that we have. It's the gold standard. We want the Maserati of
Yes.
preventive tests. So
Dr. Dang, what about cancer markers?
Okay.
A lot of patients actually just go and have their cancer markers checked without doctor's prescription. What can you say about those cancer markers for colon cancer?
cancer markers are not considered part of the arsenal in terms of cancer prevention. There are different reasons for doing tumor marker tests, and it is not appropriate as a test
For
for
screening.
screening. And so it might be a good test for someone diagnosed with cancer
Already.
in terms of monitoring for treatment response. But if we are doing a pure screening test, that's not
The
option
best
for
screening.
us.
It's not really. So, Dr. Laya, let's go to lifestyle changes. Are there any that we can do to minimize our risk for colon cancer?
Yes. So going back to what the risk factors are for colon cancer, there are some things that are beyond our control. We can't control our age. We can't control our genetics. That's how you are made. But there are a few things that we have control over. We have control over deciding what we will eat for breakfast or lunch or dinner. We
Tocino versus
oats. Or fruits and vegetables, mga ganong bagay.
Oh, so we have that power to decide.
Correct. We also have a choice in terms of, do we want to smoke or do we want to quit smoking? Do we want to drink alcohol, or can we just save that for special occasions? Definitely those are the things that we would want to help direct patients towards. And this is not just for digestive health. This is for overall health.
Not just adding years to your life, but adding life to those years.
Yes.
So it's good if your life has a good quality and you're not just alive but sick and
Yes.
fighting away cancer. So prevention is still better than cure.
So that's probably the biggest thing in terms of what we can do to modify risk. It's to get yourself screened. And so undergoing some kind of screening or prevention program and adhering to those regimens will significantly reduce the risk of developing colon cancer and can definitely impact your health if you ended up, knock on wood, being diagnosed with early cancer. Kasi meron tayong magagawa. May mga
Yes.
remedyo naman. Kailangan lang natin alamin if it is something that we need to work on.
Yes, I agree. Dr. Lai, is there anything else you'd want to tell our audience regarding colon cancer?
Yes, so March is Colon Cancer Awareness Month. And Colon Cancer Awareness Month means everybody who wants to get a colonoscopy done or any kind of screening done, this is the month to do it. St. Luke's also offers a lot of programs and packages to encourage screening because St. Luke's does want to prevent cancer, improve the lives of patients, and make everybody healthier. So please get yourself screened. Even if March is done, for any month we can do a colonoscopy and we can do screening tests for you. Please do talk to your gastroenterologist so that you can go through the different options so that you can find the one that you feel will fit you best. I always tell patients, any test is better than not getting a test. So please choose one of the three. Colon cancer can be prevented, and so let's all get on board and
I
prevent
know.
colon cancer.
Thank you, Dr. Laya, for shedding light on colon cancer and colon cancer awareness to our audience. We are grateful for your time, your expertise. Gina-bina tayo. Thank you for really spending time with us for this podcast session.
Thank you. I am enjoying it. I love having a chat with you tonight. Thank you for having me here.
And this is Jing. Thank you for tuning in to MD in Focus. Remember, your health is your greatest wealth. Always consult your St. Luke's specialist for more reliable health information. Remember to click the follow button. Until next time, stay well.